Hi, I'm Deborah Kimmett, developer of Practical Movement. Practical Movement blends functional movement re-education with postural assessment. This demonstration shows you an activating movement. An activating movement provides neuromuscular retraining to the targeted muscle along with its synergists and antagonists. This requires the client to move the targeted muscle through its full, comfortable range of motion. The activating movement I'll demonstrate is for the shoulder. Before doing the movement, I want to get a sense of what the client's shoulders are doing and how the client is experiencing them. Ideally, a postural assessment is used to rule out any structural differences first. Anatomical differences in the legs and in the innominate bones, which is another name for the hip bones, can also play a role in the postural imbalances in the shoulder. For example, a short leg can cause the hip on that same side to rotate anteriorly, while the shoulder on the same side can appear to be in a normal position as the body attempts to right itself in gravity. But when the hip rotation is addressed, sometimes the shoulder will actually be posteriorly rotated. This same type of issue can occur where the shoulders are being affected by what the hips are doing, even when there's no structural issue. In this demonstration, we'll assume that the issues are in the shoulders only and that there's no structural issues or postural issues from below affecting the shoulders. First, what I'd like you to do is to get on the table, lie on your back, and let's see what your shoulders feel like. So Katie, first what I'd like you to do is to get a sense of what your shoulders feel like. You know, are they touching the table the same? Is there any discomfort? Does anything feel uncomfortable at all? Are both of them touching the table the same? Does one feel higher than the other? Just get a sense of what it feels like. Once we have that baseline, then what we want to do is turn the client onto the side to do the movement. Anytime you have a client in the sideline position, you want to support the head with a cushion. So let's go ahead and turn onto your side. This movement is called the side-lying shoulder movement. It consists of several parts and is great for shoulder issues. I give this movement to anyone who has shoulder problems, as it moves the scapula and all the muscles in the shoulder without moving that humerus into flexion, extension, or abduction, all of which can be painful for some clients. Sometimes adduction can be painful too. I use this movement as a way to get everything moving. Then we can go on to the other movements. So the first part is a superior-inferior movement. So Katie, what I'd like you to do is to bring your shoulder up towards your ear and then down towards your hip. Nice and easy, without effort and without strain. Take the movement as far as it feels comfortable and without discomfort. Nice and easy, without any kind of strain. A little bit slower, if you would. Just a little bit slower. There we go. Can you feel those glitches in there? Now, sometimes if the client can't feel those glitches, I'll ask them to take their hand and put their hand on the shoulder. So why don't you go ahead and do that, just so people can see that. And then that way, that can help you feel what's going on in there. Okay? And again, we're looking at doing it nice and slowly. We want to do it without effort. We don't want to go into any kind of discomfort. And we want to see if we can begin the process of smoothing out any of those glitches, scenic routes, if it's not on a straight line, if there's anything going on in that shoulder that is not a nice, smooth movement. Okay? And relax. The next part is to take the shoulder anteriorly and posteriorly. So what we're looking for here is a nice straight line motion again, straight through the shoulder here. And we're also looking for the shoulder blade to slide away from the spine as far as it feels comfortable and towards the spine as far as it feels comfortable. Now, one of the things that you'll notice is that my fingertips are underneath the scapula, assisting the movement as it's coming anteriorly, and then I'm placing my thumb on the scapula to assist it in moving posteriorly and sliding towards the spine. That's one of the pieces that can be very important in teaching this movement to your clients, is that our hands want to be behind the movement, helping the movement, assisting the movement, helping them to move through the movement without getting our hands in the way. Nice and slow. Let's slow it down just a little bit more. And see if you can feel that nice straight motion. See if you feel any glitches in the movement, and see if that can change. See if you can change that. There you go. And relax. Good. What we're going to do, Katie, is combine the two movements together into a diamond. And how we do that is we take the superior-inferior movement and the anterior-posterior movement and use those endpoints of those movements to make this diamond. So what we're going to do is bring that shoulder up towards your ear, then we're going to bring it halfway down but all the way forward, then all the way to the midline as we bring it all the way down, and then all the way back as we bring it halfway up, and then back to start. So that's where we're headed with this movement. What we're doing is combining straight line movements through two different planes, and that this will challenge the nervous system even more. Okay, so let's bring the shoulder all the way up and let this arm rest along your hip. Okay, so we're bringing it all the way up, and then we bring it halfway down and all the way forward, and then back to the midline while we're bringing it all the way down, and then halfway up while we bring it all the way back, and then back to start. That's where we're headed. So we want to take it through that movement in a nice fluid but straight line movement as we go down, coming down towards the bottom, halfway up as we come all the way back, and then back up to start. And let's see if we can do this without stopping this time. Think about making the movement smooth. Is it jerky? Are there any kerchunks? Any kind of hesitations? And that's what we're trying to smooth out and change. Now, let's switch directions. We're going to go all the way back, all the way down, but to the midline. The next thing that we can do then is to do part 4, which is instead of straight line movements, now what we're going to do is make a circle. So this ups the ante even more because it further refines the movement incrementally because the movements are rounded rather than being in straight lines. So what we're looking for then is bringing it up to start, then circling around to the front, circling all the way back down to the midline, circling all the way back and halfway up, and then bringing it back up to the start. And looking for it being a nice round movement, no ovals, no flat spots. Let's slow it down just a little bit. And let's just kind of keep the hand in about the same spot. It can move around just a little bit, but I'm really wanting the movement to come from the shoulder and not so much from the elbow. Let's reverse direction now. Going back the other way. The client can do the other shoulder, then lie on the back to sense in and see what she notices. How do you feel, Katie?
I feel great. I feel more balanced and even, especially my right feels more like it's on the table, whereas before it was lifted off.
So the shoulder was lifted off the table before and now it feels like it's more on the table?
Yes.
Okay.
It's noticeably different.
Okay, great. Please remember that these movements are powerful. It doesn't take much. Do not do too much. For example, for this movement I suggest starting with 20 to 30 seconds for each part, which means that to get through all of the parts and doing parts 3 and 4 in both directions shouldn't take any more than between 2 and 3 minutes per shoulder. Remember the guidelines. Is the movement smooth, straight, or round? Is it going on the intended path? Nothing should hurt. Caution the client not to go into pain or discomfort, strain, or effort. The guidelines handout provides strategies to ensure that the client does not have discomfort during movement. Do the movement slowly. Pay attention to the quality of the movement, not the quantity. Practitioners, your job is to help your client find the movement. Use your hands and your words to help the client do the movement properly and slowly. Use this movement to start the retraining process in the shoulder and see how it works for you.